Our next speaker is John Sambrook. Sambrook.
Hello, my name is John Sambrook. I live at 11227 Northeast 128th Street, Unit I-102 in Kirkland, Washington, 98034. My software engineering business, Common Sense Systems Incorporated, is headquartered at the same address. This topic is a difficult one for polite company, but while infants are at risk, I won't be silent. All genital mutilation is wrong. It's wrong when it's done to little girls, and it's wrong when it's done to baby boys. While female genital mutilation is usually named for what it is, male genital mutilation is hidden behind the benign-sounding word circumcision. In early October 1959, a day or so after I was born, I was taken from my mother to a procedure room in the hospital that was out of earshot of my mother so that she could not hear my screams. I was then unswaddled and strapped to a papoose board, and then for the next 20 to 30 minutes that the procedure normally takes, the most sensitive tissue on my body was ripped, crushed, clamped, pinned, and finally amputated. All of this was done with no anesthetic. My adult hope for my infant self is that I passed out quickly from the pain. I am not alone in having had this done to me, entirely against my consent. This barbaric practice has been performed on millions of American men for generations, and it continues to this day. When a person undergoes trauma, the brain records it as an implicit memory. Such a memory is not recallable to consciousness. It is persistent and it affects the entire course of a person's life. If, for some reason, someone wanted to give the majority of American men an essentially undetectable case of PTSD early in their lives, it would be hard to come up with a more effective strategy than routine infant circumcision. This raises an important question. How can such a destructive practice seemingly hide in plain sight for so long? In my view, it can hide, in part, because of a conspiracy of silence. No man who has been circumcised wants to admit that he is damaged goods, but in fact, he is. And no woman who has allowed her son to be circumcised wants to think that she actually wounded her son for life, but in fact, she did. Many myths surround this moral crime. More common ones include, it's cleaner, it's a religious preference, and he needs to look like his father. As regards cleanliness, all that need be done to clean an intact infant's penis is to wipe it with a wet wipe from base to tip without ever trying to retract the foreskin, which is normally fused to the glands during childhood. As regards religion, there are no ghosts in the sky or anywhere else that care about your child's penis. You are supposed to care for your son's penis when he is young. A critical aspect of that is simply not mutilating it. As regards a child's penis needing to look like his father's, I suggest that a loving father can simply talk with his son when he is old enough and explain to him that he loved him so much he would never allow him to be harmed in the way that he was harmed as an infant. In closing, I ask the council and my fellow citizens to research circumcision. An excellent starting point is the YouTube video, An Elephant in the Hospital. An Elephant in the Hospital. I also recommend the trailer for the new movie, American Circumcision. American Circumcision. If you watch these two resources, your view on this procedure will be changed forever. Please, learn what genital mutilation really is, and then join me in the work to end it. No child, male or female, ever deserves to have their genitals mutilated in service to a collection of obviously false myths. Thank you for hearing me.
Thank you, Mr. Sambrook.